Aye.
Aye.
Are there
Aye.
any opposes? Hearing none. At this time, we'll entertain a motion for approval of minutes.
I move to approve the minutes.
Okay, is there a second?
We're
Motion
actually
by, motion.
We actually don't have minutes on the agenda.
No minutes. We're in a committee meeting.
Am I at the wrong meeting here? I am at the wrong meeting. Hold on a second. We got too much going on at one time. Okay, here we go. Got it. So, so you have received your, thank you, Maggie. You have received your public comments that was sent to you via email. We ask that you please take the time to review those comments that has been sent by our constituents so that you have an opportunity to know exactly what's being said. At this time now, Ms. Jeffries, you are now in charge of the Strategic Ed Committee. Ms. Jeffries? Okay.
I was muted. CCSD Safe Restart Plan.
Right. As Maggie Dangerfield puts the slides up so that everyone can see, I will introduce myself. I'm Jarita Postal Wait, Superintendent of Schools, and I will start by going through some of the slides that summarize the plan. Most particularly, I'll start with some information that we've received since we published the plan last week that make it clearer, I think, and will address some of the questions and concerns that many people have raised. I want to thank everyone, the hundreds of people who over the past few weeks and months have worked with us to begin pulling a plan together. Today happens to be the anniversary of the first man to walk on the moon. And just as our country came together back in the 60s, a number of civil rights and other issues, we need to come together now. This is a time for our community to try to find a way forward that works for everyone, works for our children first and foremost, but for families, our staff members, the teachers who are in the classrooms who are online working with children every day. So we are determined to continue to work with the board and the community to find the best possible solution to a formidable challenge that's massively complex. If we could move on to the next slide. I will say, as the slide is advancing, Jeff Baroli, Carolyn Belcher, Joe Williams, Michelle Simmons, Don Kennedy, Bill Brigman, Erica Taylor are all going to address quickly some of the key points of the plan today. And I want to thank Natalie Ham, our district's counsel, and Edward Boyd, who had communications along with Erica Taylor for all of the effort that they have given to pulling this plan together. So this is the information sort of in sequence since we published our plan on Wednesday. We circulated it widely throughout the community, and then very quickly we received some additional information. So the plan that we published did, as I said, represent a lot of work that had been contributed by many different staff members, community members, and others. And then on Thursday, the governor issued his recommendations, either Wednesday or Thursday. And then Thursday, the state superintendent met with all of the superintendents, either in person or virtually. And then Friday, we received really clear guidelines from the state regarding the components that had to be in the restart plan. So the important thing from this page, that this slide that I want to make clear to everyone is we're going to provide some additional information as we review the slides tonight. We will make sure that that information is incorporated along with whatever the board recommends in the revised plan that will come back for second reading next week. With respect to the COVID rates in our community, we know they're too high for us to implement the plan as we shared it on Wednesday. The slide shows the DHEC heat map. So clear, Charleston has too many cases of COVID-19 to put the plan to bring children back in person in place if we had to make that call for tomorrow, for example. But our hope is a few weeks out, we may have a different situation. In the meantime, we continue our discussions with medical experts to see if we can get some more finely conceived metrics to guide when it will be safe to bring even some students back in person. In the meantime, we have the DHEC guidelines that have been issued for the entire state. The bottom line, we'll continue to use medical experts' advice to determine how we can open schools when we reopen them. We hope that the board will approve September 8th as the restart date, but the manner in which we restart will depend on the conditions that exist in our community. So we're asking everyone in our community to please wear masks, a face of some sort if you go out, wash hands frequently, and social distance to the extent that's possible. That's how we will help everyone drive the rate down and get our children who want them back in school just as quickly as possible. Next slide, please, Maggie. These are the required restart plan components that we received from the State Department in writing on Friday. And I will hasten to say that everyone who's working on some solution to how we can restart schools is working as hard as we can. So we don't intend to imply any criticism that we didn't receive these guidelines until Friday. And the guidelines may change again, but every district is required to have 4 key components in their plan. We must offer parents a choice between in-person and virtual. That doesn't mean that we would open schools if conditions are unsafe at the time, but we have to offer parents those options so that we can plan really well and be ready to open schools when it's safe to do so. So I'll point out that we're encouraged to offer 5 days a week, but the State Department will accept a plan that has a blended learning model in it on some days and off some days. In the virtual option, we plan to do our own program. The italicized words on that, under that bullet point are important. Any virtual model must include initial in-person contact with students. So we need some time to get the virtual model set up, to which option parents want, and then to make sure that we provided an opportunity for small groups of students to come in and meet their new teachers before they come online for the first time, if that's the option, the mode in which we need to operate. The third requirement is that if virtual is the only option, then we need to provide a time frame that explains how frequently we'll examine the situation and see when a transition makes sense. And then finally, we were required to establish how we'll deliver high quality instruction. And we are required, every district is required, it's in the state legislation, to offer 5 additional, they're called leap days, for students in grades K through 5. We don't have to bring in all the students every single day, but we have to bring in a few students at a time so we can diagnose where they are, learn a little bit more about them, analyze what their needs are, and then respond to those needs with instructional plans. So the highlights of the plan, we're good, Maggie. It's fine to go ahead and advance to the next slide. Thanks. The highlights are first and foremost, student and staff safety and well-being are our #1 priority. They are paramount. We'll reopen for in-person instruction when the medical experts say it's safe. And right now, the only metrics we have are those that are published by DHEC. As I said, we're hoping to get some more granular metrics that might allow us to bring back some students when we're able to do so. We're hoping by September 8th, the infection rate in our community looks different than it does today. That is an optimistic wish, but it has been our aspiration from the outset to be able to bring children back in person just as quickly as it's possible to do that. Parental choice. After the board approves the restart plan next Monday, whatever version the board approves, we will need to offer parents these options. It doesn't mean that we can implement them right away, but we need to know which parents want 5 days a week in person, which parents are more interested in a hybrid model or a blended model, some days in school and some days. We already know that in some of our schools, that's the only thing we'll be able to offer because of space and transportation limitations, or whether parents want a virtual academy. And if you have an elementary or middle school students, you could choose Virtual Academy, our totally online program for 9 weeks at a time, and then opt back into an in-person setting if one is available at that time. For high school students, the Virtual Academy would need to be 1 whole semester so that high school students could complete a course. I'm repeating myself, September 8th is our start date. We need to get children back in just as quickly as we possibly can. Some parents don't want their children in school and are very comfortable with virtual and can provide the support, have the Wi-Fi connection, have broadband service, but that's not true for all of our children. So we need to make the in-person option available as quickly as it's safe to do that. And we need to be ready to move from total virtual to some in person and back again as conditions change throughout this year. We're going to have to stay resilient and flexible and able to move one operating mode to another. So that takes a great deal more preparation to make sure that whatever services we offer are both safe and effective. The very stringent health and cleaning protocols. We will use the protocols that are approved by DHEC at the time. I think everyone knows MUSC is working with Charleston. They've actually visited a few of our schools. They're creating a back to school safe playbook or guideline booklet. And we will make sure that all of our schools meet those standards before we even think about moving to online, to in-person instruction for anyone or asking our personnel to come back into the schools. So next slide, please. The last thing that I want to talk about after the highlights is the slide about the learning gaps, the learning loss. This slide just shows the projection in reading. It's from the Brookings Institute. The source is shown at the bottom of the slide. But if you look at the dotted line right down the middle of the slide, it pegs where children were in reading. In the top, the purple line shows the 4th grade, and at the bottom, the darker blue line shows, the top line shows the 6th grade, and the bottom line shows the 4th grade. The middle line shows, it takes children at the top 4th of their class at the 75th percentile, and it goes upward. It says children who were in the 70th percentile actually gained some in reading, even though they were learning virtually. But if you look at the students who were in the bottom 4th, at the 25th percentile, their learning not only declined, it declined at a much faster rate with virtual learning than it would have normally. So the point of, we want to make 2 points with this slide. One is, we look clear over on the right-hand side, the gap between the 75th percentile children and the 25th percentile children is bigger, wider, greater than it would have been had we not been teaching virtually from March to the end of May. And also, we want to make the point that it's much more difficult now for teachers. It's a much bigger challenge as we restart school, trying to figure out how to help the children who fell behind catch up, and how to do it in a way that addresses their particular needs by giving them more support and more direct services just as quickly as it's safe to do that. We'll do the very best we can virtually, but we know that they will learn faster and we can provide instruction more effectively if we bring them back in person just as quickly as it's safe to do so. So I'm going to turn it over to Jeff Baroli to talk a little bit about the health and safety measures that we have taken so far and will continue to work on. Jeff?
Thanks, Dr. Postlewaite. Again, I'm Jeff Baroli, the Chief Operating Officer for the district. In one short slide here, I'm going to provide a lot of details, the next level of details within the CCSD restart plan that was provided last week. And I will say, as we move forward, once we receive that MUSC back to school playbook, we will provide additional detail within each of the departments, essentially a cookbook, a day-to-day, how things are done in the schools. And so this is but the highest level here on this one slide. It does incorporate, and we always have kept a guiding light on the Accelerate Ed recommendations, which include a number of DHEC guidelines. And of course, we'll continue to adjust that as new things come in, as changes come in from both DHEC, the State Department of Education, as well as our medical professionals. From a cleaning perspective, the first bullet there, we're going to be looking at doing disinfection twice a day, once during the day, once at the end of the day, for bathrooms and high-touch surfaces, fogging once a week, and that's when students are not in the building, and that's our maximum capacity to do that at this point. It's using a chemical that has been used in our schools for years, and so this is nothing new. It's just looking at rolling it out more frequently. We're going to be disinfecting our buses twice a day between the morning and afternoon, in the evening. From a facilities improvements perspective, I'm sure most of you are familiar with the divider concept that we're moving forward with. We have plexiglass, some plexiglass on board now. Construction has begun in earnest, and that will allow us to better meet social distancing protocol by having dividers between a lot of students, and in order to bring more students into a safe environment. Bottle fillers, we want to try to get away from the drinking fountains, and we're moving toward that. And from an HVAC perspective, which I know is the concern of a lot of parents and teachers, there's been a lot of work done this summer, and will continue until school starts. We did analyze every single system that we have to make sure it's operating at peak efficiency, meaning we are maximizing our fresh air throughput by making sure that equipment is up and running, and also improving our filtering protocols by upgrading those filters to better handle viruses. We're also looking at upgrading the nurses' clinics, and we already have received HEPA filter units in each of those clinics. In the event that there is an ill student, both the nurse and the student will have improved air quality in that space. Dr. Postlewaite mentioned the capacity and challenges with buses. My call and plea to every parent is to let us know whether or not your student is going to ride the bus or not. We may be in a position where we have to issue bus passes to ensure that we have the students that are assigned to that bus, because we are under strict guidelines of the amount of students that can be on each bus. We are looking at routing plans right now, and hope to have some additional information later on this week on which schools may be able to get additional bus runs, again, to maximize the number of students that can be brought back to school safely. From a feeding perspective, we are looking at having children come to the lunchroom for breakfast and lunch, meeting the nutrition staff in a no-touch environment to get their meals, to take them back to the classroom. This will ensure accountability and also improved choice for our students in getting the food that they want. We do have to be able to arrange for those that are authorized to get meals when they're not in school, and that would include the virtual school students, and we're looking for a pickup schedule for that. Finally, I just wanted to quickly cover COVID protocol. A lot of feedback from parents and faculty on what happens if something does happen in a school. And we have protocol in place that we've enacted and are using right now that includes contact tracing by our nursing department. It is very rapid. It's streamlines the process to ensure that we identify those that may have had contact with somebody who's positive and determine those that need to be quarantined, and the level of cleaning that needs to be done in the respective spaces. So there is no one size fits all. It all depends upon the case that occurs, but it requires a very rapid investigation. And that's something we've been able to do so far. We'll refine these protocols that includes the school notification for parents and families. We're working on that now, but we want to make sure we stay within the HIPAA guidelines to protect those that might be ill, but get the parents as much information as we have. With that, I'll just close by saying again, we're all planning on staying aligned with the MUSC playbook as we move forward once we receive it, and stay in alignment with all the guidance from above. So with that, let me turn it over to Carolyn Belcher.
Thank you, Jeff.
Now you can
Hi,
move the
I'm
slide. There we go.
Hi, I'm Carolyn Belcher. I'm the Chief Academic Officer. So first I want to frame this challenge. We've been getting a lot of nice emails from teachers and families understanding that this is a really challenging time. But in learning services, we use this framework as we thought through our plans for what we're going to be doing over the next year. Now, first and foremost, it's health and safety of our students, of their families, and of our faculty. We want to make sure that with the partnership with Jeff and his team, that people feel very confident that the best safety procedures and the most well-documented at this point social distancing protocols are in place. Second is equity. We met, there are many people who are not on this call who are involved in this plan, including the principals across the county. And when we started to do the planning for this, the principal said, if I can fit more students in my building safely, I want to be able to do that. So that does mean that we're going to be able to do more for some students who need more. And I want to make sure I'm explicit about that. And then the third thing is well-being of students and staff. From my perspective, we've all been through a trauma, more than one, unfortunately. One is with the COVID crisis. Many people know have folks in their family who have been sick or God forbid, passed away. We suffered great economic hardship, obviously. And then at the same time, our larger community is going through a national effort to stop police violence and end systemic racism, both of which have caused a lot of feelings and emotions. And we need space as a community with kids and with our faculty to process all of that. So making sure that we build time into the school day to process feelings, whether it's in a virtual format or an in-person instruction, is going to be a key priority. And then accelerating academic learning. As Dr. Postlewaite highlighted earlier in this, the gap is immense on where students are now from where they were when we closed on March 13th. It's going to be very important that we cover more than a year's worth of academic content for every student within this year. So when I talk through those priorities, I want to make sure I highlight that the idea here is that they are in priority order. We're not going to worry about academics until we're sure that people have the health and safety, equity, and well-being. But let me be clear, we want to make sure that we're getting to all four of those priorities this year. We just recognize that we're not going to be able to get people to focus until they feel confident that they're in a safe work environment. Right now, if you're a parent in CCSD, we're planning to offer you essentially two choices, and they vary depending on the school that your child attends. If your school is able to bring back 100% of students safely, so the physical plant allows social distancing, as Jeff's team has worked through, then we're going to offer 5 days a week instruction. Now, that may mean that class groups are grouped unusually in order to make sure that we're keeping that distance in place, but the goal, again, is to get as many students back as possible. If you're a parent who doesn't want that, the virtual academy is an option for you. In about half of our buildings, we are not able to accommodate at this point all 100% of our students. In those buildings, we're going to offer an alternating schedule of AABB. What that means is that students in the A group will go to school on Monday and Tuesday, and on Wednesday, Thursday, and Friday, they will have virtual instruction. If you're in the B group, you'll go to school on You'll have virtual instruction, or at-home instruction on Monday and Tuesday, and then have in-person instruction Wednesday, Thursday, and Friday. That Wednesday, at least initially, we're going to use to give time for the students, for the faculty, for every adult at the school building and parents to get used to the schedule to make sure we're following the protocols. So we anticipate that whatever day we open that's safe to open, the first 4 weeks or so, that Wednesday would be time for faculty planning, student testing, IEP meetings, and small group meetings with students. But for the most part, it's making sure that the building is ready and that teachers are ready for the next couple of days of instruction.
So thank you, Carolyn. Great evening, everyone. I'm Joe Williams, and I work with secondary schools here in CCSD. So now that Ms. Belcher has covered the instructional models that we're considering here in our district, I would like to share a sample of the AABB Day, which is our in-person schedule, and also the virtual academy schedules with you. The first one we have up is the in-person schedule, our AABB Day schedule. And in that schedule, for the group that will be physically in buildings, all core classes to include math, ELA reading, science, and social studies will be taught. Students will also have scheduled related arts, and examples of those are art, music, and PE classes as well. Now, a critical piece in every child's schedule will be scheduled time to address social emotional well-being. I want to make sure we point that out. I would also like to point out that during the off days when scholars are not physically in, this work will be independent due to the fact that teachers cannot physically be present for both. Teachers will, however, set up for students. There is time built into this schedule initially the first few weeks to allow time for teachers to become acclimated to this process. The virtual at-home learning piece of the AAB Day schedule will take into consideration scholars who prefer paper assignments over virtual ones. Next slide, please. So here we have a sample, again, academy schedule. And our virtual academy schedule has the same offerings as the in-person schedule, with the understanding that there will be a balance between scheduled class time with the teacher virtually and independent work that needs to be completed by scholars. And additionally, outside of the virtual classes with teachers, there will be time for conferencing and support from teachers. I want to state and clarify that as well. Now, while we have these basic guidelines for scheduling, schools will have flexibility on how these offerings are arranged in each of their schools and based on each child's needs. Next slide, please. Now that we've seen the instructional models, examples of the schedules, I want to delve a little bit deeper into Virtual Academy. And our CCSD Virtual Academy is dramatically different. I want to repeat that, dramatically different from the opportunities we all had to shut down schools in March. So we have built a solid virtual academy to support the learning of scholars for families that prefer this option. Through research, we developed a quality curriculum by using resources from proven providers, including SC Virtual, Florida Virtual, and Edgenuity. We are also looking to secure a program that allows for better support of scholars and teachers that take part in the virtual learning experience. Teachers will be trained on how to use this program effectively. Now, I want to point out for the Virtual Academy that scholars enrolled in our Virtual Academy will stay enrolled in their home schools for the purposes of athletics and other activities. Now, as it relates to enrollment time, I also want to point out that there is a commitment for 1 semester for high schoolers and 1 quarter for middle schoolers, unless they're taking high school courses, and that's 1 quarter for elementary students as well. At this time, I'm going to be turning it over to Carolyn Belcher.
So as I said when I talked about our priorities, one of our priorities is make sure that we accelerate instruction in this period of time. So when I say that, that is maybe a simple concept to state, but actually a very hard one to do in practice. Specifically, we need to make sure that we're not taking an orientation that's more remediation or intervention, but instead make sure that most of our students are getting exposed to the grade level work of the grade they're currently in. So even though all of our students missed that final quarter, we want to make sure that they're focusing on moving forward into new content. So then when you accelerate instruction, you have a sense of what are the priority standards. So we're not going to cover all of the curriculum in the 4th grade. We're going to prioritize and make sure the priority standards are covered. And then we're going to make sure what is taught at the 3rd grade in the final quarter that's needed to understand this 4th grade level concept. And then in real time, try to make the bridge for students to that previous content. Again, I'm making it sound much easier than it is. So to make sure that we have some resources available for students and for teachers to help with that, we're making a few investments now to prepare ourselves. First of all, as I've shared with this board before, the acceleration schools are going to get additional support. So we are contracting with a professional development provider to provide in-school coaching and work specifically on the curriculum, the math curriculum, which is new this year. Not only is the idea that we'll do a better job of executing the math curriculum if teachers have more opportunities to see proven professionals model it, to get coaching on their work, and to look together at student work. We also think that that will allow teachers and kids to see what it means when kids are doing more of the intellectual lift of the lesson. We're investing in a new math curriculum called ZERN. Before anyone panics, it's very tightly aligned to the Bridges curriculum. It is a K-5 to curriculum. The reason why that we think this investment is worth doing just for this year at least is because it's designed for our current reality. The way that it's set up is that normally a teacher does a direct instruction lesson with manipulatives on the conceptual understanding of the math, and then students go and work independently with a device in the classroom. Given our balance of in-person and at-home instruction, the device work can happen independently, whether it's in the classroom setting or at home. Also, everything that's presented for an independent lesson is also available in hard copy, which allows us to accommodate students who may have limited or poor internet connection on that day. Additionally, right now, our curriculum and instruction department has recruited some of our strongest elementary teachers from across the system to put together the teacher-directed portion of each of the math lessons in Bridges and the phonics lessons in Open Court. The idea here is that a teacher doesn't have to introduce a new letter sound. They could use the videos that we provided, and then they have to do the hard lift of connecting that new content to the individual kids that are in their classroom. At the acceleration schools, we'll make sure that the ZERN curriculum is included in the professional development that those teachers have.
Good afternoon, everyone. My name is Michelle Simmons, Associate for Elementary Schools. I'd like to take a few moments to walk us through our blueprint or our plan for supporting specific domains and groups of boys and girls. First, student assessment. We believe that we will be able to offer a version of the MAP assessment for students in grades K through 9 when students return in the fall. And for boys and girls in grade K through 1, we will be utilizing the Fast Bridge assessment as well. We believe that this period of diagnosing student skills and readiness will be paramount at that time. Overall student supports, the Department of Alternative Programs under the leadership of Jennifer Coker, her and the team are designing roadmaps for every level to include lessons, resources for trauma, social learning standards, as well as cultural competence. Training will be provided for both teachers and administrators across Charleston County School District. For our early childhood population, we are anticipating that our child development programs will begin approximately 1 week thereafter our kindergarten through 12th grade students. We will reduce the number of students who participate in these programs, keeping in conjunction with the social distancing guidelines. We also intend to enter our boys and girls on a staggered schedule in order to acclimate them to the all school experience. For students with special education and 504 needs, we are expecting that teachers and our service providers will continue to provide special education and related services based on those IEPs and 504s. If and when a family selects a non-traditional model or schedule of instruction, the IEP team or the 504 committee will convene with parents to consider any impact on student needs. Thank you, Maggie. We've come to understand that this effort, this situation we find ourselves in, will be a long, winding, and protracted process of continuous monitoring and adjusting. So our plans in the coming weeks are outlined here for you. Starting as early as this week, we are expecting to collect feedback on a plan from the board today that we can get information, input from task force members, teachers, the legislative delegation, and the community at large. During the week of July 27th, about 1 week from today, we're expecting our Board of Trustees to approve a version of a safe restart plan. By the beginning of August, we are intending for families to confirm whether they will be opting for a virtual academy or in-person instruction. It will be very important for us to determine which of our families anticipate needing bus transportation and those who will need support with Wi-Fi connection and access so that we can adequately support our families. We will also be working with our Human Resources Department to poll teachers to find out what their needs are as we attempt to return to school. By mid-August, we intend to finalize individual school enrollment for virtual academies. And this will in turn allow us to get tighter, more precise our restart efforts. By August 11, we intend to have teachers report to work for the purpose of planning and development, as well as material and device distribution. By this week, we should also have a finalized version of a safe reopening plan that can be shared publicly and widely. For the week of August 19, we are holding to that deadline so that parents can be notified of our restart efforts for September 8th, whether that's in person or virtual. Also, the week of August 19, our intentions are to support, assist, and help our families prepare for a virtual instruction experience as appropriate, as needed. And finally, the week of August 31 through September 4th, our intentions are to invite our K-8 students into the schoolhouse for an orientation-like experience in small groups to meet with their teachers. We can assess their learning needs, review how to use and maximize our online tools. These days are designated by the State Department as LEAP days, learning, evaluating, analyzing, and preparation days. Thank you. I'm turning it over to Mr. Brigman at this time.
Good afternoon. Thank you, Michelle. I'm Bill Brigman. I'm the Chief HR Officer for the district. And I wanted to provide a quick overview of how the district will support employees who need to take leave due to COVID-19. So this slide highlights our employee leave process as it relates to the Families First Coronavirus Response Act, FFCRA, that went into effect April 1 of 2020 and expires December 31st of 2020. In addition to the FFCRA, we did update our district leave policy, GCC, GDC. We updated it with an administrative rule that outlines the FFCRA. So there are two provisions for employees that provide emergency leave. The first is emergency paid sick leave, which is 80 hours, and that covers the need for an employee to be quarantined. And something that's really important about this piece is that we've had employees concerned that that may come from their accrual of their own sick leave, but it does not. This is emergency sick leave that we are required to. It also covers when an employee needs to care for an individual. Another part of the act is the emergency family and medical leave expansion that covers child care for up to 12 weeks. If there are other needs related to COVID-19 for an employee to be out on leave, we'll handle that on a case by case. On the right-hand side of the document, you can see the process of applying for leave. Thank you. I think I'm turning it over to Don Kennedy.
Yes, thank you, Bill. This is
Sure.
Don Kennedy, the Chief Financial and Administrative Officer for the district. And so the next two slides, I'm going to talk a little bit about the cost associated with reopening. And on this slide here, we have it in two sections. On the left-hand side, the cost associated with reopening for safe schools in September. This is what Jeff Baroy, the Chief Operating Officer, covered. And I'll go through that table here in a second. Then on the right-hand side are some of the academic costs associated with the reopening. We'll highlight, though, that these costs for COVID-19 do not reflect total costs that we expect to incur for the complete fiscal year. Only the cost mostly for getting the schools opened up safely and making sure that we have the academic components in place whenever we open back up on, well, I guess on September the 8th. So on the left-hand side here, estimated operations cost. divided into several sections, plant operations. And so these are the items that are needed to make sure that we have appropriate cleaning within our school buildings and within our classrooms. So you can see fogging machines to sanitize classrooms, disinfectant chemicals, etc. The next section here on maintenance in our HVAC or air conditioning and heating systems. Ms. Barori talked about the filtration system. And so they've done a tremendous amount of work on trying to make sure they have the right filtration systems in place. And so there are costs associated with that as shown here. There at the bottom here on the maintenance and HVAC section, the $1.5 million, the classroom partition fabrication. So this is the acquisition, delivery, and installation of the plexiglass partitions to divide and separate and provide the social distancing. The next section, transportation. And so there's a tremendous amount of effort to disinfect buses, as Jeff indicated, twice a day. And so the costs are shown there. And then all of the supports that are needed for the nursing services, making sure that we have a nurse in every single school. We have the appropriate PPE equipment, the vaccination requirements, et cetera. So the cost there on the left-hand side, again, associated with the safety protocols. On the right-hand side, the table here reflect costs associated with the academic side of the equation in the school reopening. So at the top here, social emotional learning, what it says here is extra duty, extra pay. And so for existing employees that may need to put in, or we need to have a requirement for them to work extra hours, there's additional pay associated with that. And so that applies to several of the items here, the social emotional learning, the English language learners that are next in the lineup here on the table. The next one, the $2.2 million for curriculum and instructional interventions. So embedded in that number are things such as the acquisition of a new curriculum. So Carolyn Belcher had mentioned the new curriculum for math, and so that's included in that number. There are a number of initiatives here for curriculum development, both in terms of the blended learning. So there are new instructional models that have to be created for that type of instruction, as well as curriculum development and instruction development for virtual or digital learning. The next one, additional supports for exceptional children. So I think it was Michelle talked about the IEPs and then the additional supports that are being put in place there. We talked already about the virtual learning, so you can see the dollar amount there. And then the visual and performing arts supports, there's additional amounts put in to provide some digital components of that work. Formative assessments and universal screening to determine where our children are academically, and how then what's our starting point for engaging with interventions with them. Early childhood learning here. And then the next one, ebook subscription and expanded digital content and textbooks for the digital world that we are moving towards this fall. And then additional supports for gifted and talented learning, primarily, again, extra duty and extra pay for additional work there. And then on the notes, note one here, the costs shown on this page do not include any amounts for potential increases in the number of substitute teachers that might be required this year. And then the second note here, I've mentioned already that the costs here do not include what we expect to be the total COVID-19 costs for the fiscal year. Primarily, these costs are associated with getting us started on a safe path this fall. Next slide, please. This slide, so the state has projected that of the CARES funding, the federal CARES funding associated with the COVID-19, that we will receive $13.4 million. So in the upper left-hand corner here, it shows the 13.4. We have an indirect rate percentage that's approved by the state. We have to take that from the top, and that gives us $12.8 billion that's available to distribute for the COVID-19. And the way that distribution is going to take place is by enrollment based on the 135-day enrollment count. And you can see for CCSD schools, including our charter schools, as far as 6,739 students. The private schools will also participate in the $13.4 million grant application, and that their estimated enrollment as of last week is 3,185. We are meeting with the private schools this week individually, of the 19 that have agreed to participate, or that have indicated they will participate. And so we will finalize their enrollment later this week. But right now, I expect that number to be roughly where you see at 50,000 enrollment. Simply take that number and divide it into the available 12.8 million. And then for each student allocation, then it's $256.27. And then on the right-hand side here, some examples of the use, how we would use those funds. The virtual school, you saw $1.6 million. The safety measures that we've talked about, $4.3 million. The academic supports, you can see that number, 4.9. The charter school allocation would be an additional $1.1 million. Private school allocation, 800,000. Then the indirect cost that I mentioned before, 600,000. And so those are the preliminary costs here. The process or the steps to be able to acquire that $13.4 million from the state are shown. Those steps are shown at the bottom. So one, we have to determine the areas of need, and that's what we've been doing, both in terms of the private schools, the charter schools, the safety measures here in the traditional schools, as well as the academic components. And then we collaborate with the private schools. We have a deadline of July 31st by the state to finish that component. We are collaborating with the charter schools. And then once those costs are finalized and the collaborations are concluded, then we would develop and submit the grant application. And I do not anticipate that happening until at the earliest, around the first week or so of August. So that is it. And I think perhaps it's back to you, Dr. Postlewaite.
Thank you, Eddie. So I thank you all for the feedback that you gave us at the time we published the plan. We tried to the extent of our ability to respond to every person who contacted us. We read all of the input, and I hope you see that the more detailed information that's reflected in tonight's presentation and some of the changes that we've made reflect our understanding of your priorities and needs. Secondly, I just want to say this is the bottom line. Every educator will tell you that they would much prefer to serve students in person. So that's what we're planning to do. And until we know that we can do that safely, we're also planning for a virtual delivery system. We imagine that throughout the course of COVID-19, there are going to be times when we have to use both options, and we want to be able to move fairly flexibly from one to the other. We're really proud of the way our teachers and other staff members responded this past spring. We could not do this without their efforts. We're planning on behalf of children, for children, on behalf of all of our teachers. So thank you to board members for allowing us to talk on for a little bit and explain in more detail the plan that we published before we had the clear guidelines. And Erica Taylor is going to explain to everyone how to give follow-up to the plan when the revised plan is published.
Thank you, Dr. Postlewaite. My name is Erica Taylor, and I'm the Chief of Staff for Charleston County School District. And once the plan has been revised, we'd like for everyone who has any more suggestions to send them to saferestart@charleston.k12.sc.us. That email address is listed on this slide. We will make sure that that email address is also posted on the homepage of our website, and we'll also make sure that it's shared on our social media platform, so everyone has an opportunity to offer any additional suggestions that they have after the revised plan has been shared. And with that, I now turn the meeting back over to Reverend Mack.
Okay, a number of information have been shared with us, and I know board members have questions in reference to what has been shared. So I'm going to go down the list and just ask board members at this time to ask their questions, and just so that we can make sure that we have get our questions asked. Board members, if you can just be specific and direct as to what your question is. We want to make sure that the question is asked and answered. So I'm going to start with Reverend Collins. Reverend Collins, do you have any questions?
Yes, sir. Thank you. Can you hear me?
Go ahead.
Yes.
Yes.
Okay. Thank you, Ms. Barrow, and all you guys that participated in the presentation. Overall, it's somewhat thorough. I want to ask a question. At what point do we start, if you're looking at opening schools back up, at what point do we start virus testing? Do we allow people to come in and not know whether or not they have the virus, or does everyone have to be tested first? Or we just simply look for signs like fever, or temperature, or coughing? So what's the initial protocol for us testing concern for both students and employees and those associated with the district?
Mr. Borelli.
Certainly. So our current approach is to make testing strongly recommended. We set up test dates with Feder Healthcare right now, this week and next week, for teachers coming back in early August. What we have found is that there's a lot of folks in this area that want to be tested. We've also found that the turnaround time is extremely challenging as far as when we get the results back. So that is something that is a concern of ours. It would be nice to know if a person is positive, they can be quarantined along with those close contacts before they get back into a school. But obviously the risk is if they're tested and there's a delay in getting the results, they could certainly contract COVID between the test date and start of school. So it's not a fail-safe plan, but something that we're pursuing. We're also looking at the possibility of doing swab tests, getting approval to do that with our nursing staff. That would allow for more focused testing so that folks aren't waiting in line, and we could get that test done, get it turned in. That is still in the early stages of development. So we're, to answer your question, Reverend Collins, we are looking at it. We would like to do it, but we're obviously constrained by the support of others in that approach.
So right now, it will not be required, and right now.
Correct. It wouldn't be mandatory.
All right. You mentioned about the classrooms, and you said you would have desk dividers where needed.
Yes, sir.
So when you say where needed, so what would be the protocol to establish where the desk divider is needed?
So if the class size is small enough and there's enough space in the room, there's a chance that dividers wouldn't be required for us to achieve 6-foot social distancing. So if you've got a school, a classroom of size of 800 square feet, and there's only 10 kids in the class, those desks could be spaced out so dividers wouldn't be needed. Right now, we're putting as a #1 priority the classrooms that absolutely need the dividers in order to get the social distancing spacing that we would like.
So, okay, I've got 2 more and I thought I'll be done, I think. That was a good answer. The disinfecting in the classroom. You said twice a day you disinfect the bathrooms and the touch surfaces. So in the classroom, you have your desk surface, your door handles, the door itself, other desks, you have the walls. You have things that kids touch, just out of curiosity, not necessarily a reason, especially younger children. And you said disinfecting twice a day. Who would be responsible for that twice a day cleaning in the classroom? And is twice a day enough for active children?
So our goal is to, again, clean the touch surfaces. That would be things like doorknobs. So that's part of the example that you just gave. We would not be cleaning desks in classrooms during the day, only the bathroom. The presumption is that students are at their desk. They're the only ones at their desk. There isn't a shared desk. They're at a space that they're the only one that sits there. If they are at another location, we would look at the need to clean that surface. So an example would be if we cycled children down to the cafeteria to pick up their lunches to bring them back, we would make sure all the touch surfaces in the cafeteria are wiped down before the next class comes in. When you look at it from a practical perspective, we could always increase disinfecting. There comes a time where the cost to do that outweighs the benefit to do it, as well as disruption to learning. Essentially, the kids are going to be in class all day with the exception of picking up their lunch and possibly going out for recess. To get around to all the classrooms, either while they're out or while they're in class to do cleaning, just doesn't seem to be practical in a learning environment.
We may be a little weak in that area. We have to make some modifications, but I'll move on to the school buses.
Okay,
if you're occupied a bus at 50%.
Reverend Collins.
Yes.
Reverend Collins, just I failed to mention I'm asking each board members to ask each question until we can get through with everyone, just sort of in the interest of time to make sure that everyone get their questions answered. So since I just said that and you already asked two, can you go ahead and ask another question? Then I'm gonna move on to the next board member. Then come back to you.
So just keep it to 1 or 2 questions.
Yes.
Okay. All right.
And then I'll come back to you.
That's fine. I appreciate that. Okay. So I'll stop at this one, Mr. Burrow. So on the buses, if you do 50% capacity, as my memory serves me, it's been a long time since I rode a school bus. Seemed like the seats were about 2 feet apart. So are you speaking about putting 1 child per seat, or 1 child on the front seat and skipping the next seat, then placing a single child, or you're speaking about just one child per seat throughout the whole bus? Just give me an idea of what you're speaking about.
So it would rotate between 1 child and 2 children per seat. And that is in direct alignment with the guidance put out by Accelerate Ed that is supported by DHEC. We are recommending at this point that all children on the school bus would still wear masks as an additional safety protocol for that bus ride.
Just to make sure I heard you said 1 to 2 per seat.
Yeah, so it rotates. In one row it would be 1 child, in another row maybe 2 children, back and forth.
Thank
you. So they would be seated at the extreme ends of the seat, obviously. And yes, they would be closer than 6 foot.
Okay. Mr. Hollenshed? Mr. Hollenshed?
Let me unmute myself. Can you hear me now?
I can hear you now.
I have a few questions, but I'm just going to, for the sake of time, I know what Robert rules once we have the floor. We're supposed to say what we're supposed to say, but anyway, let me move on. This is for our Chief Academic Officer and Dr. Postowicz. Basically, and this goes back to a few months back, I believe it was Michael Miller. I think it was actually board member Cindy Barton Coates and Chris Collins. You just got to talking about a new math component, which is Zen Math. And then my question is, with that, will the teachers be trained for a year in that? The other thing is, why do we need a different math curriculum in order to accelerate learning? So much was spent on the bridge program that I believe Cindy talked about a few months back. Which schools will be implemented with this new math program? And then, is this the right time to go into something like that when we spent so much money in the bridge math program? And I think you remember that, Dr. Mack, Reverend Mack, we had a heated discussion about that. So I'll give her a chance to respond to that before I go to my second question.
Learning services.
Sure. So Thank you, Mr. Hollington. I appreciate the opportunity to answer your question because I'm sure other people in the community are wondering this too. I think the good news about Zern is it's one of those publicly available curricula that essentially you're paying modest licensing rights and the cost for copying it. So the overall cost of Zern is $500,000 for the entire district, which is significantly less than Bridges or Illustrative or some of our other curricular investments. Now, the upside on Zern is that it's tightly related to our Bridges curriculum. So they're similar. The big difference is the medium. So Zern is designed to be taught primarily, Bridges is designed to be taught primarily face-to-face in the classroom. So it takes quite a bit of a lift for a teacher to adapt to a face-to-face online medium or a packet model, which is quite tough. Zern allows the mobility between those three different mediums more easily. And it is not our expectation that we require it and make it an extra lift. We think it's going to be easier for teachers in this reality. That's why we're pursuing it. We want to make it as easy as possible to accelerate instruction, because that's the hard part, is making sure that we catch students up on more than a grade level's worth of options. We will probably likely continue to keep the numbers corner that we do within the elementary classroom in Bridges, and we'll be giving guidance on how to use it. I think we're just trying to make sure that we have better tools than we probably had in the spring to make it easier for teachers to do their jobs as well as they can.
And that also in details training in, right? I mean, teachers already know the Bridge program, so that's going to take time back to get them implemented in this particular program, correct?
That's right. I mean, I think the good news is that the hard work of both the Bridges and the Zern curriculum is related, and that is making sure that the teacher is not over explaining, but in fact letting the children grapple with the math. That is the big part of the curriculum, is that show that, you know, the number one is one object, or the additive properties that you're putting things together, and that kind of thing can happen as long as the teacher doesn't over-explain. So I think that the upside on this is that some of the work like OGAP, we did something called OGAP training for teachers, which is around the conceptual understanding of math. That's totally relevant to Zern. So it should, and again, Zern is a little more user-friendly in the virtual environment in addition to face-to-face.
Okay, and then how much did it cost for our Bridge program that we spent thus far?
Well, now the Bridges program is going to be covered by the state because it's a state adoption.
Gotcha. But there's still a cost associated with that, correct?
We did, because we were ahead of the state. We made an investment in previous years this board approved, so that some of the schools are already on the Bridges math program and the illustrative math program. But my understanding, and forgive me, this is my first year, but now that the state has approved it, that cost will be absorbed by the state of South Carolina. But Dr. Postlewaite, please jump in if I'm not saying that correctly.
That's correct. It's that when the state, you're right, Mr. Hollington, of course, there is a cost associated, but it would be associated anyway because the state's updating their mathematics program for the entire state.
Okay. And then I got one more question after this, Reverend Mack. Then I'll yield to the other questions. I have done some research. I've noticed in Atlanta, Georgia, how they're handling their virtual education. And then the one I really was intrigued by, Reverend Mack, and I wish that you would take a look at this also, Charlotte Mecklenburg. They have a situation where the teacher familiar with those children come in for 3 days a week, and the children in the area of critical need are actually taught how to work with virtual learning for 3 days a week, and then they're given their assignment, and then they're checked up on. That is something I think that, I don't know, I heard the presentation just now, we have to have more dialogue, but I think that is more incumbents to our teachers than anything else. And then I think we also need to worry about teachers that are diabetic. I had calls today, teachers with diabetes, some that take care of elderly family members. I hope we're listening to our teachers to understand the validity of the decision that we make. So other than that, Reverend Mack, my last question is and this to you, Reverend Mack, also with Dr. Postlewaite, you know, before any vote can be made, and wrote this down, on changes of the start of school date, and the board must update on every new curricular initiative for the school district that will be rolled out in 2020 and 21. So in other words, will this become rolled out in a chronological order by school that we understand if it works or don't work? Are you getting what I'm saying, Dr. Postowitz?
I'm not sure, Mr. Hollenshed, but it would forward me the question. We will make sure that we address it for the second reading next week.
Okay, I definitely will, ma'am. I appreciate it.
Thank you.
Ms. Coates? Ms. Coates?
I'm here. I'm sorry. So, is CCSD using the guidelines created by Accelerate Ed Task Force and DHEC to determine when we would actually open the building?
I think that's probably, this is Jarita Postlewaite. I believe that's probably my question to answer, although other cabinet members may know the parts of the Accelerate Ed better than Accelerate Ed. It is the task force that Superintendent Spearman put together, of course. It had 13 members originally. Our district had someone serving on that task force, and we have paid attention to everything they've said. The guidelines they put together were that regarding safe school restart, indicated that DHEC would create indicators that were recommended for a district to use if the incidence of COVID-19 was low, medium, or high. Subsequent to that report, I believe DHEC did the low, medium, high indicators, and those are the to which I referred at the beginning of the presentation. Right now, they're the only metrics we have. Our question is whether sometime this year, if for example, there's a certain statistic in there that calls for our rate of incidence of COVID-19 to be below 10%. It's the last time I looked, slightly above 20%. If we get to 12%, might it be safe to bring some children back to school if teachers and parents are comfortable that we've created the right safety environment? So when I talk about wanting something a little more granular, that's what I'm referring to. But the simple answer to your question is yes, we are following those guidelines. That's what we have shared with the board to date. And our question back to the community, MUSC in particular, is whether there is a level of granularity if we see a 14-day straight decline in our outbreak rates, and there are other indicators that the area is beginning to get the spread of the disease under control. Could we begin to bring back some children in some settings? That was a long-winded way to say yes, and we are looking at whether or not there are some more fine-tuned metrics that could be used.
So that does bring a second portion of that question is I've heard about this MUSC playbook and MUSC. Has MUSC committed to creating that playbook before September 8th? And are we committed to following that playbook? I mean, is it still just a theory, or is this something the public can grasp their hands onto?
Mr. Barowie?
The playbook is something that everyone will be able to see. To be completely transparent, it will give us different options to do things. It won't just say, go do it this way. It will provide different methods and procedures to do things in schools. Some may not be completely possible in certain schools, some may be. We had hoped that would include a more definitive model of when we come back. Piggybacking onto what Dr. Postlewaite said, we're not now expecting to get that as part of the playbook. So we are still short any further guidance right now, right today, on what are the metrics to when we determine kids can come back to school in some form or fashion. That is something we're trying to get our hands around.
Okay, so if I can try to figure out what you said, they are committed to creating this playbook by September 8th. It will be transparent and published, for lack of a better word, but it may not include metrics that are defined as this is the right metric to start or open a building. But we will see a playbook from MUSC before the 8th.
Correct.
Okay.
On both. And
And so-
they have, and to make it clear that we're not simply waiting on them, they, as Dr. Postlewaite mentioned at the beginning, they've walked several schools with us and we gave them the information that we've been proposing. So the information that's in this presentation, most of it was shown to those professionals, and there's been no, I'll call it pushback on things that we're planning to do at this point. So we try to stay aligned with what they were thinking along the way, knowing that we wanted to make sure if there were adjustments we needed to make, we could try to do some of that before the playbook came out. So I'm very comfortable in what we've been planning so far, and that it will be in alignment with what they'll come out with. They may ask for some different things, but the things we're planning now are in alignment with that. We'll hope to be alignment with that.
Because I think the confusion is what happens when we open the building is one question. Will it be safe? Will it be secure? How will it look? Will we be able to protect the people, et cetera? But mashed into that, which I think is what we ought to peel out separate, is what is the metric before we ever unlock the door to the building? And right now, I think I'm hearing that the only metric to deciding when to unlock the door to the building is the DHEC metrics. Is that correct?
Yes, ma'am.
Everything else comes as, if we open the building, here's the playbook.
That is right. Right now, we have only the DHEC metric. We are in conversations with the folks who run those analytics that are on USC's website. They're a little more detailed than DHECs, and they pertain to the areas that USC serves directly. So, one can imagine the amount of extra work going on in USC right now, but just as quickly as they can help us, they are committed to working with us on some more refined metrics. We've also had an outreach effort to a couple other entities that may be able to help us. If we don't have some better metrics by within the next 2 to 3 weeks, our only option will be to go DHEC metrics. And that's what we said initially we would follow. And that's all we have right now.
Okay, and I have,
Okay. Cindy, was that your 2 questions?
no, that was 1.5. Can I do one more real quick? Very
right.
simple. And this is for Ms. Belcher. Carol, the big question is, everybody's being asked as parents to make a decision on virtual, in-person, and not necessarily a decision. We need them to commit to how they want it, even if we have to come back and tell them we cannot accommodate that. I get that. But the question is, how do I make that decision when I don't know what virtual will look like? Or how do I make that decision when I don't know whether my school's an AABB and my other child's school's a 5-day only option? When will that kind of information be available so that they can make that decision?
So, Ms. Belcher, Mrs. Kosa, I'm not sure if the response falls in your area or Mr. Baroi's. I think that it's the analytics on Mr. Baroi's side and squaring that with learning services. But Mr. Baroi, do you want to answer that, or Ms. Belcher a little more?
I'm just asking, when are we going to have those building level details and virtual details so that a parent can truly assess what they want? They may decide that their school is a 5-day-a-week school and they don't want that and they want virtual versus their other child. When will we know that stuff definitively?
Yeah, Mr. Baroi?
So from the building perspective, we're about halfway through our schools now in detail, in which our facilities personnel have laid things out along with support from the principals themselves. So that process is about halfway through. We're hoping to start middle schools this week and have middle schools and high schools done by 2 weeks from now. So this week and next week we'll need that time. As we're going through that process, we're matching that up with bus transportation. Again, the best we can do at this point is take initial survey results, compare it to bus usage last year. It's really speculative, but to try to identify shortcomings with buses, because that could be a limiting factor as well. Going back to the answer to your question, the bottom line is we hope to have a good handle on the school capacity, how we can get kids to school within 2 weeks. The maximum number.
Okay. Mr. Frazier?
Thank you. First, thanks to the staff. I think you've done a great job of, as Ms. Coach said, providing clarity on having a safe school environment for our staff, teachers, and other folks, as well as our students, when we open them for use. Today, we presumably would not open them for use, given the information we have. And so then it gets us into the whole virtual conversation. And I would ask, one, presume that we open virtually initially. Would we then be using the virtual academy resources for our students and stick to the same off ramps that we prescribed earlier, which is a 9-week or a semester? So I guess that's a question for Ms. Belcher, or if in fact we open virtually, 8th or otherwise. Is that the method we would go, or would we engage the folks that would have otherwise been in the classroom to provide a different sort of a virtual learning experience?
Right, Ms. Belcher?
Certainly. And thank you, Mr. Fraser. I think it allows me to also answer the top of Mrs. Coates' question. Forgive me for not answering that on what people would need to know around the virtual academy. I think our reality is that all schools are going to have to prepare for 3 different settings: a fully virtual setting, a setting where some of the instruction is going to be able to be done in person, some of it's going to have to be done at home, whether that's virtual or through written work, and a fully in-person setting, because hopefully at some point during the year, we're going to be fully in person again too. I think one of the ways in which we're thinking about this is that we have planned the virtual academy for a projection of around 1,000 students, just to have a sense of what would that involve. And we are hiring right now teachers for that virtual academy who are the best at virtual instruction. Our assumption is that number might change as we get more information from parents on what they actually want. And based on that, we're obviously going to know which schools have more families that are interested in the virtual academy, and it may be disproportionate, and which schools have more folks who are interested in returning in person. We're then going to obviously adjust our staff, which might mean pulling some teachers to involve them in the virtual academy in order to make sure that we're meeting the needs of all the students. The advantage of the virtual academy was we have proven providers who've done this for online, which will be a little bit stronger than anything we could do ourselves. Yet, and still, if we're doing it at scale, that's part of the reason for the investment in Zern and the video options, is that we want to make sure that if we had to do it for all of our students, we had that option as well, and that we did a more tightly managed opportunity than what we did in the spring. No harm, no foul is what we did in the spring. I think we pivoted very quickly. I'm just saying we know that to monitor and ensure that we actually meet more than a grade level's worth of growth, we're going to have to make sure that we're regularly assessing, monitoring, and having more set in-person instruction, whether that's in-person in a classroom or in-person through video conferencing like this.
Thank you. And I know you said 1,000 is what you planned for. I saw in the paper today that Greenville's already got 10,000 people signed up for online. So I think 1,000's going to be well short of where we end up, regardless of how and when we open. I did want to mention there's a YouTube chat channel. I hope somebody on the district staff is monitoring that, because there's a whole lot of questions going on in there as well for us to respond to. I guess my final question, Reverend Mack, you'll be happy to know Ms. Coates actually asked one for me on when will people know which schools are doing what? So I only have one more. I noticed in a slide deck that our goal is to notify families by the 19th of August what September 8th will look like. And I heard Mr. Baroe just say we need another couple of weeks to figure out what the physical plant will look like. So we're moving into that August timeframe, and I would just submit that the 19th of August is when we must tell people by the 20-day requirement. People have jobs, families, childcare, things to figure out, and to the extent that we can accelerate our ability to make a decision on opening schools and what that's going to look like, I would urge us to try and figure out how to do that, because there's, just as the school district's adapting, so are families and employers as well. So I don't know that if it's possible, because it sounds like there's still a whole lot of moving parts to put together, but I would just say to the extent that we can let people know sooner than later, we'll do both our community and ourselves a service. So it's not even really a question, just try. And thank you for all you're doing.
All right, thank you. Ms. Green?
Okay, so I guess one thing I need some clarity on, when will we know if September 8th is not a start date for virtual?
September 8th is the start date for the virtual school, if that's what the board approves. We will know whether or not we can start in-person classes on September 8th. When we look at the COVID-19 results in 3 weeks, we can't delay any further than that. After the middle of August, so our hope would be almost 4 weeks. We have to make that call so that parents know what we're going to do. Frankly, our aspiration was to be able to open up some in-school opportunities for children, but unless the COVID rates begin to drop dramatically, we don't think that the medical experts would, that is the right thing to do. So to answer your question directly, we have to make that call by August 17th in order to inform parents by August 19th.
Okay. And I'll leave the part B of that because Eric won't let me ask 3 questions. So my second question is to Dawn regarding the budget. The numbers that you presented to us today, the estimated cost for the September restart, were any of those numbers included in the budget proposals?
Yes, ma'am. Some of them were. Yes, so we do have some costs, some funding that's included in the fiscal 21 budget for the COVID-19. Although, as I indicated, the costs that are shown here on the slides today do not represent the total cost for the year. And so when we come back to the board in the fall, probably October, with a revised budget based on the states adopting this budget, then we'll have a better sense of what the total cost would be, and then what the funding mechanism would be, and for the revised budget.
And okay, all right. I'll send you my next question. I'll send you an email. Thank you so much. I appreciate it. And I just need to say thank you to all of you guys for all the work you've done. I just can't even put my arms around it. So thank y'all for your hard work.
Okay, Ms. Jeffries? Ms. Jeffries?
Hi. Most of my questions have been asked by other board members, and thank you. And I would also like to thank the staff for all the work you've done. I do follow other school districts just out of curiosity, and you've really done a lot more than some of the other ones that I have been looking at. And as a former teacher, I don't have a question, I just have a statement. I've been getting a lot of feedback from teachers that are afraid and feel like no one's listening to them. I'm just putting that out there. From the presentation today, it sounds like you are listening to their concerns. Somehow I would like that to be, I don't know how we communicate it better. Maybe after today it will have been communicated. And I was the kind of teacher who would really want to be in the classroom with my kids, but if I was teaching now, I'd be terrified. So thank you for all the preparation, and I hope people start wearing masks.
Just to echo Ms. Jeffrey, we really want to make sure that the teachers understand as well that we know we won't be able to do this without them feeling safe and having trust in the systems that we have. This week is a big effort with principals and some of the academic folks and everyone on this call to attend school faculty meetings and meet with teachers in smaller groups, the Teachers of the Year group and smaller groups. We want folks to feel confident that if we are coming back in person, the safety protocols will keep them healthy and safe.
Thank you.
Ms. Darby?
Thanks. a couple of my questions have been asked, but I've got two real quick ones. One, I just want to state too, thanks to all the staff. I know you guys are really working 24/7, and it's much appreciated. So I have some coworkers who have kids in other counties, and the parents have been asked to sign a pretty lengthy release. And are we doing anything? I'm hoping we're not, but are we doing anything for that, like that, for kids just to come back into school?
No, ma'am, we are not. Ms. Ham, do you want to say anything more about that?
So the short answer is no, that there were lots of questions about that, but our team has not discussed a release for staff or students to come back to school at all. Okay,
that's great. And then the other question is, how are charter schools, you know, we have a great relationship with our charter schools, I think, but the decisions that the board makes today and then finalizes next Monday, do the charter schools fall under those recommendations, or do their boards dictate what they're doing for returning to school?
That's a really good question. The charter schools that are endorsed or affiliated with Charleston County Schools try to stay aligned with Charleston County Schools. But the fact of the matter is the charter school board has the authority to set out a separate calendar if they wish, a separate operating regime, separate protocols. That's within their authority.
Great, thank you. That's all I've got, thanks. And
Todd,
Todd's
go
on
ahead.
the call too.
I'm sorry.
Todd is on, Todd Garrett is on. Just
I'm on, if you can hear me.
Okay, go ahead, Todd. What's your question?
Can you hear me?
Yes.
Okay, great. First, thank you very much for y'all's presentation. I just, as my 4 kids participated in the virtual, as did my 6 nieces and nephews, and just for everybody who didn't go through that, it requires a parent full-time, particularly, to work with kids on a daily basis for that to be marginally effective at best. And so for working parents and for those kids, I know that this is going to be a better option in the fall, but for working parents, particularly those with more than one kid, it is about impossible to make it effective from my perspective. And I know that we had one school in which I talked to a principal in which only 40% of her kids signed in at all in virtual learning in the spring. So I just feel like it's critical that my 4 kids, my 6 nieces and nephews, will all be back at school as soon as we can, safely for our teachers. Because I know they work incredibly hard in the spring on it, but it's incredibly important for our kids to get back as soon as we can. That's my only comment. Thank y'all.
Okay. Thank you, board members, for your questions. And I'd just like to say to staff, thank you so much for all the hard work that you've put in putting together this plan, the task force that has taken a part as well and helping. And I want to say to the community and to our teachers and staff that we are listening to your questions. We are all listening to your concerns, and safety for our students and for you as well is key and is important. And we are taking all of those things into consideration. And I'm happy that the board members asked intense questions today to get clear answers as to where we are as we move forward. So thank you so much, Dr. Postlewaite, and to your staff for what you have done to help get us to the point to where we are. And as we move forward this week, we're inviting the community at large, teachers and everyone, to please send in your questions to the Safe Restart at charleston.k12.sc.us so that we can hear your feedback as well from what has been presented today as we move forward.
May I ask
I'm sorry.
Can I ask 2 short questions?
All right, just 1 second. What'd you say, Ms. Darby?
I just said I have a motion when we're ready.
All right. Okay.
I have a question too, if I may.
Okay,
So
Cindy,
my
you said
first question.
Cindy.
Yeah, and one's a yes, no. My first question is, and it can be something that you guys give us in an update or at the next reading, but I think Fraser alluded to it a little bit, is what happens if you've got a kid in virtual who wants to off ramp at the end of the quarter or semester and there's no room in the building? That seems to be a question that people want to ask about. And then a yes, no question, it's really for the board, is do you think there's any value in possibly pushing our special called meeting back to August 3rd? Because in reality, when we have a meeting on Monday and a meeting on the following Monday, the agenda's out by Wednesday. So you're talking 48 hours. Is there any value or hardship on the district if Kate's motion is to have us reconvene on the 3rd?
So, so that I do not know what Kate's motion is. Kate has not indicated a motion.
I can go take my, well, let us ask this. I think that question is one for the staff to ask. I mean, I don't want to put them off on being able to move forward.
Yeah, that's why I wanted to ask it in case it's something you did want to put in your motion, but we definitely need the staff to weigh in on that.
So the game plan is to have a special call meeting on the 27th. So that's the original, that's what's on the table. So Cindy's now proposing another question as to whether or not a delay of an additional week beyond that, which is August 3rd, I think you said, Cindy?
It is.
So Dr. Postaway, I guess the question comes to you as to given the work and the time frame of trying to reassess what has been presented and questions that we may get or from the community as a whole. How much of that would impact 2 weeks from now versus next week as far as decision moving forward?
We've talked tight timeline to notify parents to figure out what our options are and so forth. And so the longer we delay the board's approval of a plan, the more it tightens up that timeline. So I think it's a really good idea, Mrs. Coates. I think our preference would be to keep the meeting for this coming Monday on the agenda. We'll have a plan ready by Friday afternoon. We'll publish the revisions we know we have by Wednesday. We'll update that this Friday afternoon. If the board gets online for 15 minutes and decides a week from today that we haven't presented something you can approve, then I think we move it a day at a time till we get it right, because every day makes a huge difference for us right now. I really appreciate the offer.
So just to be clear, are you saying that staff cannot move forward until we vote?
We can't formulate the options for parents until you vote. And that's the driver right now. It's a chicken and egg. It's almost, it's really convoluted. Parents need to know more. The more information they have, the better choice they can make. But we need to have a better idea than just a, to which 40-some% of our parents respond, what parents are thinking right now in terms of these choices, with the understanding that when the time comes, every family has to make the decision they feel is best on September 8th.
Okay, I believe Reverend Collins had a question.
One
question.
Yeah, it's actually two, but I'll make one sentence. What's preventing us from opening up virtually mid-August? What's preventing us from doing that, the virtual online by mid-August? And what would be the mask enforcement in the classroom?
I'm not sure I understood the second part of the question, so I'll answer the first one really quickly. The challenge opening up by August 18th virtually is the preparation it takes to get ready, and the fact that we are required to meet with students face-to-face before we open virtually. So we have to open much differently if we open virtually than we operated last spring. There simply aren't enough weeks between now and August 18th to get everything done that has to be done. So that okay, is
my thoughts. I thought you guys are working on that all summer long.
Sir?
I thought you guys were preparing all summer for a virtual opening, just in case we have to go that way.
We've been working steadfastly and unflaggingly. And Friday, we received clearer guidelines. Every week we get more clarity. It will take us until at least the last week of August to get ready to open well under any option.
All right.
The other Yep. We have to offer 5 additional days for K-8 students, and we have to, I mentioned we have to meet with each student virtually. And then I didn't get the second part of your question. I'm sorry.
Who will be responsible to enforce the mask stays on the children? Because sometimes my children may go with me to the store, so now I hear them complaining, I'm tired of this mask and want to take it off after 20 or 30 minutes or so. So how do we keep the mask on the student all day? And who's going to enforce that? Whose responsibility?
Whatever mask wearing protocols are in place have to be in place, and the age of the child will make some difference in how we respond. But we'll give gentle reminders, some coaching a bit, but this is something we can't negotiate. Ms. Belter, did you want to say more about that?
Only that we're going to call up the code of conduct later in this meeting to Reverend Collins, which has been adjusted for this context. And I would just say, like, this is an adaptive leadership challenge for all of us, and that is going to be true for classroom teachers and principals as well. Like, we're going to have to make decisions real time in classrooms on how to keep kids safe, how to keep the adults safe, how to make sure that we're dealing with kids in a caring and loving way, but also in a firm way so that children are safe for themselves and for their families at home too. So, I think it's going to be one of those things that we're all going to have to reinforce. And in my experience as a principal, usually around like September and November, we start to slip, and we can't slip on this. Like, this is one of those things that it's going to take all of us as a community committing to get it right.
Okay. I believe Ms. Darby has a motion, but Mr. Hollenshed, I believe you had a question.
Yeah, just a comment. I think I agree with Dr. Postwicks, but just think we need to keep it on the 27th and move forward.
Okay. All right, Ms. Darby.
Yep, I move to approve first reading of the state start plan for us to have a special call meeting on July 27th.
Second.
Okay.
I can't hear. I don't know what she said.
Ms. Darby, if you could please repeat that, it didn't come through clear.
I move to approve for first reading the Safe Restart Plan and to have a special called meeting on Monday, July 27th to consider for second reading.
Second.
Okay.
This is Todd.
Todd, second that motion. Motion made by Ms. Darby, second by Mr. Garrett. Reverend Collins, how do you vote?
No.
Ms. Coates?
Yes.
Mr. Frazier?
Yes.
Mr. Garrett?
Yeah.
Ms. Green?
Yes.
Mr. Hollenshed?
No.
Ms. Jeffries? Ms. Jeffries?
Yes.
Ms. Jeffries?
Yes, sorry.
Okay. Ms. Darby?
Yeah.
And I vote yes, that motion passes 7-2.
Well, Mac, may I ask a follow-up question, even though we've
Sure.
already voted on that?
Yes.
With regards to the virtual start date of the 8th, if we aren't able to send kids back in person on that day, which it probably looks like we aren't, when and how do we make the decision to start the in-person? And I know it's going to be based on DHEC's data. I guess my question is, hypothetically, suppose the numbers start to decline and we're at a position, let's just say October 15th, that we all feel good that it's safe to send the kids back to school. What happens?
So Dr. Post may answer or comment thereafter, but right now, tentatively, we're proposing starting September 8th, right? And tentatively by August 19th, we're proposing to give either a virtual or in-person go live per se. given the numbers and the guideline, either we will go, 9 weeks, or we'll go one semester. And as we get more into it and the numbers decline, I guess at that point we'll come back and we'll make some modification as to where we can fully engage in classroom instruction without the virtual. But I believe we may have to, once you establish the virtual online, I think you have to complete that portion of it. But Dr. Postlewaite can come in and clarify that to let me know if that is correct or not, or Ms. Belcher, either one.
That's right, sir. We'll bring the numbers to the board every month. This is something that will be on your agenda. Look at the numbers, work with the medical experts. And if there is a time we can open up anything, and the board votes that we can open up anything in person, then there will, we imagine, about a week's transition time for families, our employees and our students and their families to get ready.
Okay, thank you.
Yeah, so the key is wear your mask, and I think we as the community will definitely control how soon we open back up by the number of people wearing their mask consistently, so that we can drive these numbers down and we can get back to in-person, fully engaged into in-person classes.
Mac.
Yes.
Just so there's no ambiguity, I think teachers need to hear, if numbers are like they are today, they will not be asked to come back to the classroom, period.
Correct.
So,
Correct.
So this is not, we are setting our schools up to be the safest place we possibly can for our faculty and our employees and our students. And we're not going to ask them to be there until we know we can do it safely. And so I think people need to hear that loud and clear with no ambiguity whatsoever. Numbers have got to get better or it's not going to be an option.
Right.
And those numbers and those metrics are not stuff we make a decision on. That's DHEC driven and expert driven. So we are following DHEC. It's not us that are going to pick the number and say, okay, it's safe.
Correct. Thank you.
Got it. Thank you. So board members, we're tasked to, as well as we're communicating with our constituents and with teachers and so forth, we need to relay that message to them that we won't put our kids in harm's way. We won't put our teachers in harm's way. But we can drive this destination by us all engaging together and wearing our masks. So I don't work for the CDC, but I can tell you it's important that we do that. So Ms. Jeffries, let's move on to the next item on the agenda.
The Health Advisory Committee, Advocates for Youth 3Rs curriculum recommendations.
I'm going to turn this over to Holly Cutt, who's on my team and who has led this work with the Health Advisory Committee.
Thank you. So my name's Holly Cutt, and I'm the instructional specialist for health and PE for the district. And the Health Advisory Committee is recommending Advocates for Youth, the 3Rs, which is rights, respect, and responsibility curriculum, to be implemented in grades 6 through 12. And this curriculum comes about from the consent decree and judgment that came out on March 11th and passed down from Molly Spearman, that needs to be implemented by the start of the 2021 school year. So this curriculum that's being recommended is not replacing anything that we have. This is going to be an additional option to go along with everything that is already being implemented. So basically, if you read the consent decree in the law, but the lawsuit, what the Comprehensive Health Education Act needs to be designed and implemented without regard to 593230, which basically violates the Equal Protection Clause and discriminates on the basis of sexual orientation. So this curriculum is going to meet that standard which the state is asking for school districts to implement. The committee spent a lot of time looking at the Advocates for Youth. They knew this was coming. This is not something we just put together at the last minute. They've been looking at the curriculum for over a year now, and they truly came up with some great reports for you to have read regarding the curriculum. It is a K through 12 curriculum, but we are not looking at kindergarten through 5th grade. We are only looking to implement 6th grade through 12th grade that will go into those options.
Thank you. Are there any questions from the board? Reverend Matt, can you, oh, I'll just take them as they come. Go ahead, Reverend Collins.
The curriculum being offered for 3 hours. Are there other options other than this curriculum here? Are there other options available to live and children from?
Other options that we already offer? Is that what you're asking?
No. Were there other materials available that you could choose from, other courses, other resources?
We looked at several different resources, but we could not find any that still fell in with the state law that would fit our community. Many of the other curriculums were too off-centered for what fits the needs of our students, and we didn't feel that it would be right. And this one was so involved in the social emotional and the safe place of students, and it really taught a lot of empathy and teaching acceptance, and provided a lot of bullying prevention within the curriculum, and it just seemed to be a good fit if we were going to uphold what the state is asking us to implement. And this was the curriculum when the state gave out their recommendations of what they thought would be appropriate. This was the only curriculum that they provided on the list of recommendations. Everything else were websites that teachers could use as a reference, but this was the only full curriculum, which we thought was appropriate because the committee had already started looking at this curriculum and sent those recommendations.
What is the position in the curriculum on when teaching about what I call alternative lifestyles, alternative sexuality? What's the direction the curriculum goes in that regards?
Right. So the curriculum, we're not teaching sexual lifestyles. It's allowing them to be part of the conversation. And that was the section of that law just did not allow any of our teachers to have any conversation or allow any questions about lifestyles outside of heterosexuality. And so now that we need some type of curriculum or information for teachers to be prepared for that. And that's what this curriculum provides. It gives them an overwhelming amount of information of how to respond to students when they do have questions and they're not prepared for it. We could not find one curriculum that gave the teachers that background when having these conversations with students. It's free, it's online, the parents can even access the curriculum and see everything that's going on. And it allows the teachers to fit it in their time frame too. It's not a one size fits all classroom. So, if a school is fitting this into 1 week, or they do a whole 2 week, or they want to do it in addition to some of the other options that are on there, the curriculum allows that to occur. But again, we're not teaching these lifestyles. We're including these lifestyles to be part of our conversation for healthy reproduction.
So basically, you're recognizing them.
Right.
That's right, Reverend. And I'm sorry to interrupt, Holly, forgive me, and Reverend Collins, but I want to make sure that I call out that part of the reason that we're recommending this curriculum is that there wasn't in our existing options for families. And remember, this is a parental choice around which option families choose to allow their child to participate in. But I think particularly given the high suicide rate of gay, lesbian, transgender youth, it's going to be important for us to be inclusive in our curricular options to make sure that we're keeping all kids safe. So that's the rationale behind this. But again, this is a parental choice on what the option is, and it includes all the options we had before.
Lastly, I won't spend too much time on it.
Okay, Reverend Collins.
I'll wait.
Reverend Collins.
One more thing.
Yeah, Reverend Collins.
Yes, sir.
Let's stick with the 2 questions. I'll come back to you. Let me find out from any other board.
Are there any other questions?
I just have one left. Okay.
Yeah.
Any other questions from any other board members?
Can I proceed then? All right. Actually, 2. So I do thank you for the work you're doing. We do need reproductive education, health education, sex education, because we certainly need that, and I'm not knocking that. So if the board were to vote at our next meeting, the next time we have a special call meeting, not a discussion, but just a vote, would that hurt anything? Would that throw you off course any kind of way? If we voted the next time we meet?
We really need to have it voted hopefully today, because we need to allow time for the teachers to be trained in the material before school starts in August.
So then, that being said, well, school's not starting in August. School's starting in September.
Right.
So would 1 week make a bigger difference?
Well, the teachers would need, when they come back on August 11th, but when we have those professional development days, that's when that training would occur, which is right at the beginning.
So I think our next meeting is next week, Monday, I think, or shortly after. Would that delay your plans?
Yes, because
it would, Reverend Collins, but I think the answer is that that's what's going to get the board to a place where they're comfortable voting for it. We'll defer to the board. Our preference clearly is that we make the vote tonight, largely because I think we're providing the information that the board needs to consider it. But if there's additional information that you need, that's helpful to us to know.
But I sent some questions in earlier today. I don't know if they're answered or not yet. I sent them in that I went to work and came back. But one thing I asked was that were the men going to teach the boys and were the ladies going to teach the girls? And I don't know if I got a response to that or not.
So that's can be up to the school to design it that way, but by law, middle school, the kids just have to be separated by gender. And in high school, they stay together. The only time we separate the students is just for contraception, and that's just one lesson that the students will have that where they're separated. But other than that, no, whoever the health teacher is will be trained to teach boys or girls. It should not matter.
I take issue with that, but I'll stop here.
Jeffrey, I have a motion.
Okay.
I move to approve.
I second it. Any other questions or comments?
Call the question.
Okay. Reverend Collins, Reverend Mack, would you take I don't have a list of the.
Yeah, Miss Coates has a question.
Oh, okay.
No, I said call the question.
Okay, call the question.
I said you have a
All right.
list, call down our names. Could you,
All
would you
right.
mind calling the vote?
Ms. Coates, how do you vote?
Yes. Yes.
Reverend Collins?
I'm going to vote yes, but I still have concerns.
Okay, Mr. Frazier?
Aye.
Ms. Green?
Yes.
Mr. Hollenshed?
Yes.
Ms. Jeffries?
Yes.
Ms. Darby?
Yes.
And I vote yes. That motion passed unanimously.
Reverend Mack.
Yes.
I'm going to go back and study the curriculum some more that was sent to us, and I'd like the opportunity if I find some things that need to be brought to the board's attention, to have an opportunity to present it next time we meet. If I find anything alarming.
You're requesting some additional information? Is that what you're saying? I didn't
I'm going to go study through it myself, and if I find anything that's alarming, the board should be made aware of. I'm going to have opportunity to bring it back to the board.
Okay. Well, okay. Prior to that, if you have questions, just let the department know of your questions so that they can get answered and won't be a delay in that.
And I just want to remind the board how absolutely important it is that we focus on this, how we start schools and what it looks like first and foremost. And I don't want next week to get a whole lot of items added to that agenda. We really, really, really need to be focusing on this first.
Yeah,
I agree. And can I make one comment, Reverend Collins?
Yes, please.
There's an opt-out. If parents have a problem with
whatever,
they can opt out, and so that the other kids in the classroom will be able to receive the information, and the ones who are opting out don't have.
That is good. That part I do appreciate. I recognize that early on. I thank you for that.
That was just a clarification.
Mm-hmm.
Okay.
I knew that.
Ms. Jeffries, next item? Yes.
2020-2021 Code of Conduct.
Good afternoon. My name is Jennifer Coker. I'm the Executive Director of Alternative Programs and Services. I'm bringing to you the 2020-2021 Code of Conduct. Typically it's one document, but today you have two documents which will be merged together soon. The first is the traditional Code of Conduct booklet, which has our changes for the upcoming year that the project team has been working on throughout the year. Those changes are in red font and throughout the book. We have changes in attendance, homebound, risk assessments, and then some discipline changes based on State Department regulations, which most notably would be that threats have now moved to a level 3 offense, and that code is only to be used for threats to staff or threats to the school. Intimidation will continue to be a level 3 offense, but is now only for threats made by students to students. So that will help us to identify that data more easily as the year goes on. More importantly, the addendum piece that you received defines our beliefs and expectations as we reopen amid the crises of COVID-19 and racial injustices. The addendum defines expectations for students' participation in learning activities and reaffirms our expectations for interactions with staff, students, and activities or behaviors that might impact our school communities. Some of those include expectations around safety procedures, digital citizenship, and academic integrity while remotely learning and in-person learning. We are currently working on revisions to the admin procedures manual that we, as a companion document for principals for the code of conduct, and we are working to adjust the progressive discipline plans based on potentially being remote or hybrid in the fall. So that would may look differently than a typical reopening of school. Those documents will be ready in the next few weeks as well. So I'm happy to answer questions at this time about the code of conduct.
Are there any questions?
I'll move to approve.
Second. I do have one question, Jennifer. When would the board members be able to access the final version of this document if it's passed today?
So it is at the right now being created. It should be ready in the next few days, and we can send it to the board.
Is this an action item or is it an information item?
It's an information item.
Information.
Any more questions? Okay, Buist third grade entrance criteria. Thank you, Jennifer.
So I do have one question, really only one question about this because the board has seen this document 2 or 3 times now. Can you clarify that priority number 2 is countywide? Down there at the bottom of the admission sheet, it says zoned for 80% or higher poverty schools based on meeting eligibility criteria. That's countywide?
No, ma'am. Priority 1 is the Memminger Elementary matriculation. Then priority 2 would be the students who are zoned for the 80% or higher poverty schools. And then priority 3 would be our countywide applicants.
I'm sorry, I asked it wrong. If there's an 80% poverty school not downtown in the city of Charleston, is that in priority 2?
Oh, yes, ma'am.
Okay.
If that's correct. Sorry, I misunderstood.
And you're right, Ms. Coates. Ms. Coates, we brought this to the board prior, but we wanted to make sure if there were additional questions, and Ms. Roberts led the design of this work, so is available for questions if the board has them.
I would make a motion to approve it.
Question.
Was for information.
Given we're not going to execute this policy for a couple of years at this point, it is for information.
Oh, yay.
Yeah.
Okay.
Okay.
Any other questions or comments? If not, I think that's the end of this portion.
I do have a question. The thing about the twin, the one twin admitted and the second twin is admitted. I mean, why are we doing that?
That's in your policy, Reverend Collins, and this statement simply causes us to be consistent at Memminger with the board policy that's been in place for Buist. That's the board's policy.
Yeah, I remember I was talking about that. I don't know if it's quite actually a policy or not, but I remember that it was some kind of writing we saw.
It was actually approved by the board in October of 2016.
Yeah, but I don't think it came as a policy that day, though. When you go back and look at it again, I could be wrong, but I think it came as not as a policy, but came as some kind of writing, but not a policy with first and second reading. What I'm getting at is that why focus on twins instead of just have siblings? Why are we doing it just twins that way? Like out of the blue, we could use twins instead of just siblings. Because you have to be identical, like you got to be twin, then you get in if you're eligible. I don't see that being just.
So while I think that's probably something we could bring up and discuss, it's not going to change what happens now or in 2023. And again, I'd really like us to stay focused on some of these very important things we're having to deal with in the next
Well,
few weeks. But I
well,
agree
then-
with you, Reverend Collins. If you tell me you want to bring it to a board agenda in October or November, we'll talk about it.
Yeah, we can, yeah, we do have some time because it's down the road. But today's the day of the discussion that we talk about is today. But we don't want to spend too much time on. I certainly agree with that. But I think all of our policies need to be fair and represent all families, not showing any favoritism to anyone. And I'll stop at that.
Thank
Okay.
you. Okay, that's the end of the SEC meeting.
All right, Ms. Green, policy and personnel.
Question.
Ms. Hollenshed.
Hey, I just want to make sure for the record, when we're talking about abuse and also Meminger, I just like to find out the final numbers and the breakdown on the racial breakdown of doing that adding to Meminger and abuse, so I can get that for perspective.
Okay.
That's been in a Friday update, but I'm sure staff can send us a recent update.
Say that again?
I think it's been in a Friday update, those
We
numbers,
received
but
it
I'm sure
previously.
staff can send it in this week's Friday update or one soon.
Okay.
We can. Thank you, sir, for the heads up. Appreciate it.
Okay, regarding policy and personnel, the tuition income second reading, are there any questions regarding that?
Move
I
approval.
move to approve.
Second.
Reverend Matt, can you do the roll call?
Sure. Ms. Coates, how do you vote?
Any
Yes.
questions, Mr. Mack?
Yeah, are there any? Yeah, I think they said there wasn't any. I think Ms. Green already asked that. Ms. Green, you did ask that question, right?
I did, and I
Okay.
will make a comment that there was supposed to be some follow-up on this with regards to a policy for parents who are not paying the tuition. When we were looking at this, staff indicated that they found out that we didn't have a policy for how we enforce, payment of funds. I'm not sure if there's somebody in the audience who knows what I'm talking about, but yeah, we did have, and so I just would like to make sure that staff is following up on that.
I actually asked that question earlier, Mrs. Green, and they've told me that that we'll see something after we approve the second reading. They'll create that procedure.
Okay, thank you.
Okay.
All right, so
All right.
any other questions or comments? Okay, Reverend Mack, would you please call the roll?
Sure. Ms. Coates, you voted yes.
Yes.
Reverend Collins,
Yes.
Mr. Frazier,
Yes.
Ms. Green,
Yes.
Mr. Hollenshed,
Yes.
Ms. Jeffries,
Yes.
Ms. Darby,
Yes.
and I vote yes. That motion passed unanimously.
Naming of facilities at Wando High School Center for Advanced Studies. The information is presented. Erica, I don't know if anybody has any questions, but if not, we could just vote on it.
I move to approve.
Second.
And can you list the name that you're voting to approve? Because
We're approving the
It's
East
the
Cooper.
East Cooper.
Center for Advanced Studies.
perfect.
Okay.
Okay. Yeah, it's been moved in second, so if Reverend Mack will call the roll.
Okay. Ms. Coates, how do you vote?
Yes.
Reverend Collins,
Yes.
Mr. Frazier,
Aye.
Ms. Green,
Yes.
Mr. Hollenshed,
Yes.
Ms. Jeffries,
Yes.
Ms. Darby,
Yes.
and I vote yes. That passed unanimously.
Okay, policy and personnel district procurement panel. I think that's you, Reverend Mack.
Yes, so I move to appoint Ms. Cindy Bond Coates as the chair of the District 2020-21 procurement panel as outlined in section 4410.2.1.
Second.
Okay, I might can call the roll on this one. Ms. Coates, how do you vote?
Yes.
Ms. Collins, Reverend Collins,
Yes.
Mr. Frazier,
Sure, aye.
Mr. Hollenshed,
Yes.
Ms. Darby,
Yes.
Reverend Mack,
Yes.
and is Mr. Garrett still on the phone?
No, he's off.
Okay. Did I get everybody?
No, me.
Ms. Jeffries.
Ms. Jeffries, I'm sorry.
Yes.
And then you need to indicate, Ms. Green, how do you vote?
Okay, I vote yes. So the motion carries.
Yes, motion passes unanimously.
Okay. The next is the policy and personnel. Oh, no, I'm sorry. Test assessment administration, first reading.
Move to approve.
Second.
Ms. Coates,
Yes.
Mr. Collins,
Yes.
Mr. Frazier,
Aye.
Mr. Hollenshed,
Yes.
Ms. Darby,
Yes.
I can't read my writing. The Reverend Mack,
Yes.
Ms. Jeffries,
Yes.
and I vote yes. So that motion also carries. I have to get some battery power here. Okay, so the next we have is Title IX. And I don't know if anybody has any questions, but if you want an explanation as to what this is all about, I can ask Natalie to give you a brief synopsis and a brief reason as to why this is on our agenda. Does anybody have any questions about it or want to know that, or everybody's okay with it?
I move that we approve it, but I don't have any questions.
Second.
I'd like to know.
Natalie, are you close by?
Yes, ma'am, I'm here. Board members, good afternoon. My name is Natalie Ham. I'm general counsel for the district. This policy is coming forward because not too long ago, the U.S. Department of Education issued new regulations with regards to Title IX and how investigations are to be done under Title IX. One of those requirements was that the district have in place a policy that addresses all of the changes in the regulations. This is an attempt to create a policy prior to the deadline of August 14th. I will say that this was written with the current guidelines in place. It's very detailed because the regulations are very detailed, and it's almost as if you look at one section, you really can't determine what should be left in and what should be taken out, which is why it's so lengthy. This was drafted by outside counsel. Obviously, the deadline is coming up fairly quickly. And in order to be in compliance, we wanted to go ahead and bring it forward in July. I will say that the School Boards Association is working on draft policy as well. So by the time this comes back in reading, there may be some amendments with paring this back some and making it some of it an administrative rule. I'm not sure what the recommendations will be, but we wanted to at least try and get in compliance with having a policy in place prior to the deadline.
Is that in our board docs?
It is.
Yes.
Okay, thank you.
Thank you, Natalie. So we do have a motion and a second, right?
Yes.
Okay, so Ms. Coates, how do you vote?
Yes.
Reverend Collins?
Yes.
Mr. Frazier?
Aye.
Mr. Hollenshed?
Yes.
Ms. Darby?
Yes.
Reverend Mack?
Yes.
Ms. Jeffries?
Yes.
And I vote yes. So that motion also carries, and that concludes the policy and personnel committee items. Since Todd is not here and I serve on the Audit and Finance Committee, I think the next issue has to do with two items that we need to vote on. Is that right? Sales tax extension program and fixed cost of ownership.
So this is Don Kennedy.
Information, I'm sorry. Yeah, it's just for information.
And it will
They
be
were
voted on at the board meeting.
Yeah, they were approved by the Audit and Finance Committee. So that concludes my section, Mr. Chair.
Okay. All right. If my note serves me correctly, then follow along with me. I believe consent items will be item 3B, the Health Advisory Committee. Item 4A, tuition income. Item 4B, the naming of Wando Event Center.
I think all of those A through E are all for potential consent.
Yeah, 4C, 4D, 4E, were items that would move to consent item.
Reverend Mack,
Yes.
was the health advisory vote unanimous as well?
So from my indication, yes, I don't have anyone that voted no.
Can we move that to potential consent?
Yes, I said item 3B. That's the first one I called.
I'm sorry.
Yep.
The numbers, Reverend Mack, don't line up with the same numbers on our board agenda, so we'll just need to be clear when we go into general session, because those numbers are.
Yeah, that's kind of why I was kind of like calling out the name. So let me do it again for just to make sure that we're accurate. The Health Advisory Committee, the tuition income, the naming of the Wando High School Center for Advancement Studies, the district procurement panel, and the test assessment, and the Title IX policy revision are items that I have listed as unanimous consent. All right. All right.
Do you need a motion or is that enough?
Motion. I'm sorry. I
You need a motion to put those on consent?
Yes, I do. Yes.
Yeah, I so move.
Second.
All right, been properly moved and second. Are there any questions? Ms. Coates, how do you vote? Ms. Coates?
You're on mute.
Yes.
Reverend Collins?
Yes.
Mr. Frazier?
Aye.
Ms. Green?
Yes.
Mr. Hollenshed?
Yes.
Ms. Jeffries?
Yes.
Ms. Darby?
Yes.
And I vote yes, that motion carries unanimously. So at this point now, we have a board meeting following this committee of the whole meeting today. And of course, our next committee of the whole meeting will take place on August 10th. And our regular board meeting will take place on August 24th. Keep in mind that we have a special call meeting that will take place also on this coming Monday, the 27th. And we will notify you of the time on that particular day.
Move to adjourn until 5:30, Reverend Mack.
So move. We will reassess back in at 5:30. Please, if you can, log back on by 5:25 so that we can begin promptly at 5:30.
Do we need to log out or can we just keep going here? Erica?
Yes, you can. You don't need to log out. You can you can stop your video and just come back